HSHS St. Elizabeth's.
Brad's here.
Gotcha, Brad. St. Joseph Breeze. Highland. Jersey. Anyone from Jersey? I thought I saw. Give me a quick second. Nope, I don't see any Jersey folks on. From Belleville, you got myself, Lee's on, Eric's probably on as well. Who else we got? Chester.
I'm here.
Gotcha, Georgia. OSF St. Anthony's.
Gary's here.
Gotcha, Gary. Redbud Regional. Back from Redbud. Okay. Sparta. Touche Regional. Okay. Health departments, Bond County. Calhoun. Clinton.
Stephanie Wibbles here.
Gotcha, Stephanie. See, that link worked. Here we go. Great. Eastside Health. I think Tiffany's on here. Yep. I see you, Tiffany. Anyone from Fayette? Greene County? Health Department, no. Greene County Health Department. Jersey?
Hi, Phil. I just thought I'd say hi.
Thanks, Tiffany. Hi. I hope you're doing well. And I hope things at Eastside are balanced, you know, in your, I'm thinking about, I've been watching a lot of Star Wars lately. So hopefully the light side of the Force, dark side of the Force, you're right in the center somewhere.
Okay.
Maintain your balance, young Padawan. Okay. Where were we at? We did Jersey, Macoupin County. I see two M's in the middle of my screen. So Michelle Milton's on from Madison County. That would make 3 M's. Monroe.
Vicki here.
Gotcha, Vicki. Randolph County. And St. Clair.
Hey, Phil, it's Sam.
Hello, Sam.
Hi.
Let's make sure that Beth, is Beth on? Busman? Beth, you on? Ring, ding, ding. Nope, in the chat. Okay. Greg is on. I see you, Greg. Okay.
Yes, sir.
I saw John Nowak from MedStar. Any other EMS agencies on?
Rachel Air from Ball Memorial.
Okay, gotcha.
Chuck Kelly from MedStar's on also.
Gotcha, Chuck. And I see Jeremy. Is Jeremy on?
Yes, I'm on for Muscuda.
Gotcha. All right. Anyone I missed or would like to sound off?
Natasha Womack is on for Auburn Memorial Hospital Occupational Health.
Gotcha. Thank you.
Mm-hmm.
Anyone else?
Angie Othal announced in the chat she's here too.
Who did? I'm sorry, Chuck.
Angie from Randolph County.
Gotcha. Thank you. All right. Well, we'll go ahead and kind of get started. So a week almost feels like, I don't know, it goes by like in a day. So in the COVID era, as far as information goes. So whatever you've probably heard, I'm not going to tell you to throw it away at any point in time. So if I say something that you've heard before, or I say something that you haven't heard today, the goal of today's kind of pulse check and meeting is to just kind of gauge where we're at and go over a few of the specifics on the COVID vaccine plan. Hopefully you guys have all downloaded a copy of version 3.0, which is in the D4H instance and has been sent out before. If you do not have a copy of that, again, please log into D4H, go to the library in the vaccine folder. You can download a copy of that. Please make sure that you've reviewed that and shared with your leadership and teams at your organization. I would be lying if I didn't say that the rate of information, if you guys remember how it was when COVID first started with, what are you going to do on the back of an EMS truck versus what you're going to do in a hospital, what PPE you're going to wear, and how the disease spreads. That level of changing of information that we experienced there is rearing its head once again with regard to our vaccine planning. So I completely understand if someone feels as though they don't have all the information. I will tell you, I don't have all the information, but what I will be able to discuss today, and I will not go down to I won't go to the specifics of the organization level too deep, but what we're going to talk about today is definitely I won't say the exact allocation, but the allocation process and how we will receive that allocation here and how it will be distributed from here. When I say here, the Regional Hospital Coordination Center here at Memorial Hospital in Belleville, to the local health departments, and then out to the agencies, organizations and agencies within that local health department's jurisdiction. Okay, this again, this may be a great opportunity to ask some final questions, being that we're somewhere within the 7 to 9 day range of potential vaccine making it to the state and beginning to be distributed. So this, please, this is, I would feel really good if, we asked a lot of questions, talked a few things out, and, you don't leave here without having at least your question answered or a question put in that I can follow up with, your local health department can follow up with, or someone in on my staff, my team here, whether that's Eric or Lee, can follow up with you with, because we want to make sure that this is as smooth of a process as we can. And I also would like to leave a little bit of time to talk about the actual vaccination process at the organizational level. Again, I can't tell you what to do in your organization, but we will all face some similar challenges when it comes to having whatever we have allotted and executing it in a timely manner. So that's what today is going to kind of be about. I am going to begin to share my screen. So for those of you who are on via Teams, you'll be able to see, I'll share this. It's not a ton of slides or anything. I've been piecemealing a few slide decks together, a few images from a few slide decks together, and I just want to be able to have something to keep me on track while I'm talking. So for those of you who are joined via Teams, you're probably seeing a slide says project allocations or projected allocations. Some of you on this call may know what your specific projected allocation is for your organization. Some of you do not. Okay, and that's okay. I know it may feel stressful, but right now it's okay. So kind of looking at this projected allocation slide, some of you may have seen something similar, but looking at that Pfizer allocation being around 80, this is for the state. Some of you do know, we talked about last week that a certain amount, around 26,000, is going to be for Chicago proper. And some of this is going to be, the rest of that 85,800 is going to be for the rest of the state. Okay, we'll be getting that first allocation sometime next week. You see the dates, 13th to the 19th. Odds betting are somewhere around 15th to 17th, but it remains fluid. Following that up, and you can see how that's kind of broken out, and you'll see it says what has been set aside for the long-term care facilities. On that first week, there isn't any set aside for long-term care facilities. When you get down to that next week, the week of Christmas, see the 103,000, and then seeing that 86,000 now. So we get another distro, but you can see how that kind of shifts. It moves to more for the long-term care facilities, and then you'll see that little bit over there, the rest of remaining in Pfizer, saying that 17,000 for healthcare workers. Okay. And when they define healthcare workers, you have to look on the CDC's website, but it's basically frontline healthcare workers or anyone that basically works in a hospital, because the definition goes pretty far. but you do see that the potential for us to start to pick up and the state to begin to receive the Moderna vaccine at around 174,000 doses there. Okay. Moving down that Pfizer allocation the week after, that slide that line basically showing you the breakdown there. So the total allocation around 124,000 with 43,000 going to long-term care, and then the remaining going to healthcare workers, and then the Moderna's starting to drop down but going to healthcare workers there. And then somewhere going forward, we should see a similar push. The plan is to have weekly distributions, but that could change. It may go bi-weekly. It may go maybe not every Wednesday of the week. It may shift left or right of that. So IDPH is doing the best that they can to basically prepare for receiving those vaccines. So in order to prepare for that, what have they done? They've ordered at least 20 ultra cold freezers to take care of both the Pfizer and Moderna vaccines, which require that cold storage, of which each freezer can maintain around 150,000 doses, each freezer. So 20 times that's around, at the maximum capacity would be just what IDPH purchased in the freezers for the SNS, the Strategic National Stockpile. That can basically hold on to 3 million doses. So as we start to dispense this and people use it, and or maybe they don't use all of it and they have to slow down production, they do have the storage capacity to hold on to a very fair amount. And this doesn't include if your local health department has ultra cold storage, your organization has ultra cold storage. This is solely the 20 freezers that IDPH has purchased, okay? Of which 10 will remain at the regional support sites that support the Strategic National Stockpile in a warehouse. 10 will remain there, and the other 10 have been distributed to the other RHCCs, of which we received ours this morning and is currently being fitted and finalized, electrical monitoring, all of that stuff right now here at Memorial Hospital Belleville. So wanted you to know that. So how is it being packaged? As you can see right here, this is a picture of all the packaging and the freezers. So if you see that big old freezer over on the right-hand side there, this is how it will be packaged, okay? We see the big soft box in the middle. That right there is what would be able to contain 5 trays of 195 doses each, 195 doses each. Multiplied by 5 gives you 975 doses can be in that one soft box there. If you look over to the second to the right, for those that are watching, you'll see the ripped open tin foil, and you see like a little styrofoam and then a tray. Within those boxes, they're stacked in trays. So each tray holding 195 doses. Okay. So this is what it basically looks like. Some of you have probably seen these pictures. Some of you may have not seen those photos, but this is exactly what the packaging will look like. As it stands right now, as IDPH receives that vaccine. Okay, stand by one sec, guys. Sorry. Sorry, as we're talking pharmacy, I had to, we got a pharmacist here. They're checking some of our storage here. I apologize. But as those are picked up, as those boxes are apportioned, each one of those will be packaged up and labeled. And on those labels, it'll basically say, if you can take a look at that left side box, that being a full closed box, it says test 1 and test 2. Imagine that saying St. Clair County Health Department or something like that. And then a time on there. On this specific time, it says 6 p.m. As we kind of discussed earlier, they are going to be building these boxes for each health department. Okay, so when they do this, they'll be able to maintain their ultra cold for a while, but once they ship it out, it will not go out ultra cold. Okay, it is going out in that 2 to 8 degree Celsius temperature range. Okay, and as you can see on the picture there, you see where it says 6 p.m. That's to let you know at what point in time that was packaged and is no longer considered to be stored in the ultra cold, which gives you up to 6 months of storage, which basically starts your timer to have that for approximately, well, to have that for 5 days. So if you receive it on the 1st and at 12 p.m., 24 hours, 24 hours, 24 hours, times, you know, times 5, on that 5th day at 12 p.m., the vaccine is no longer viable or should be used. So your clock starts and you will have that notification of what time that clock starts. And as
So
you can
Phil,
see over
Is
on the
there-
right, I'm sorry?
Can I ask a question?
Sure.
Is there, so the time, does it start when we receive it or when you receive it?
No, the time starts when it gets packaged. So that's why we may not have this. So imagine this they receive it day 1. They package it, maintain their ultra cold storage until they're going to break it down and put it in this shipping box to go out. That timing starts here. So that timing will start in Peoria, east side of Peoria somewhere. It will start then. So imagine that starting at 6 a.m., 2 hours to get to us here. So we're already 2 hours off that clock.
That's what I thought. Thank you.
No problem. Great question, though. And the packaging is the packaging there. So what does that kind of look like here, right? From Pfizer to the RSS out to your RHCCs, and that being me here. And then we will provide that to the local health departments. The distribution of that, I don't want to call it cloaked in darkness, but they do want to maintain some form of security. So as it does travel from the RSS, once Pfizer gets it to the RSS and it's broken down, ISP or Illinois State Police will be providing security for that transport, and is recommended at the local level to have transport from the some form of escort, I'm using air quotes, from the RHCC to the local health department and out to the end user, so to the organizational level. Now, and if Beth, I don't know if Beth jumped on yet, but I just was speaking with Beth at that part. Once it gets to us here, our goal is to be able to provide you a space and a place for that transfer to take. It's going to come up to our dock. We're going to pull it off. We'll do whatever cursory inspection. We'll sign whatever paperwork, which we're going to take a look at next, to the local health department point of contact. So in our instance here in St. Clair County, I'll receive it. I'll sign for everyone's. As it comes off the truck, I will in turn sign it over to Sam Bierman, and then Sam, she will in turn distribute it as the county, as the local health department has identified. And those numbers are being worked, have either already been worked or are in the process of being finalized currently. We may have a little opportunity to talk about that here in a second. And then again, then it will make it to your organization. We're going to offer up some space here in our auditorium for that to take place. So for instance, St. E's, if they're going to have an allocation, we're going to offer some space here. So if Sam wants to redistribute here, we're going to make it available. Sam doesn't have to use that. I know Michelle, I think she's got a plan that's in place for Madison County. I don't believe she's going to use that space or needs to. She has a plan already in place. That's totally fine. But we are going to just try to open it up. For some folks, for the length of travel, they may just want to get it back on the road and go, or they may want to be able to do it here. We're going to leave that up to you guys. What I would ask is that if you want to use that type of space to accomplish that on the date of receipt, the date that we receive it, I would ask that you guys just let me know. And we will make sure that we have a space for you when you get here. Okay. How do we get notified? I will get a call the day that our allocation makes it to the RSS. The RSS, they will in turn call me and say, all right, we've got your stuff. We've broken it down. We are preparing to ship this out, and the target is 6 a.m. the day following. So if they receive it at 10 a.m. on day one, we would expect whatever that date is, they will maintain the ultra cold storage, and then we should receive it after 6 a.m. on day two. Again, that's the target time they want to get that out on the road, so we can all have kind of like the exact same time frame. Once I get that call, I will, at each point along, I will contact Greg Atterbury, and I will contact Beth Busman and let them know the dates or the date and time that they said that we should expect it, and when it's getting packaged, I will let them know all those dates. Beth will be the conduit to discuss it to discuss those times with all the health departments. Myself and Lee will we will talk with Greg about the times and everything, but we ask that the local health departments make sure that they relay that information to their organizations that they're providing the vaccine to. We don't want to step on anyone's toes and mess up anyone's plans. So we'll keep Beth and Greg in the loop. The local health departments will keep the organizations in the loop on when and where to be. Okay. Again, I just want everybody to know that we'll have room and space to try to accommodate that transfer here. But if you want to do that back at your local health department or an organization within your jurisdiction, that's totally up to you. We don't want to bog down any part of that system. So I'm going to take a second right here just to pause on everything that we've discussed at this point in time.
Hey, Philip.
Go ahead. Go ahead, Michelle.
Just a quick question. How is your the ancillary supplies being packed or in this process? Are we getting it from you?
Great question. So yes, that's a great question. Let's go back up. So you will receive in turn 2 boxes. Okay, one being the soft box with padding and insulation. The other being general supplies to support vaccine operations. So there is a list of needles, basic supplies. The only thing I don't think it's really coming with is gloves. So, but that basic list of supplies. Now, there was some conversation on how much of that is packaged. Is it in certain groups, like up to 100 each, and how is it tariffed? I don't know that specifically, but yes. So you would expect to receive, let's say, a soft box or 2 boxes with your allocation for vaccine, and then whatever support materials that went along with it. I just don't have that list here. It was in one of the briefings. I just don't have it right here in front of me.
So basically, Phil, this is Lee for everyone on the line. Basically, what they said yesterday was that if you were receiving 100 doses, you'd receive 105 syringes, basically just enough to get you through in case one breaks. But supply-wise, they were talking, at least Andrew had indicated, they were going to try to ship a box of gloves and some gowns out of the IDPH stockpile along with those. But there was no specific quantity other than to say we'll try to throw in some extra PPE to support.
Hopefully, Michelle, that answers your question.
Yeah, it gives me a better idea. I mean, it's still, we'll see. We're all good.
Now, a few things just of note. Scott Swinford, he's deputy director over there at IEMA, has discussed several times on, they're trying to make this as smooth as possible. And between IEMA and what we're doing at IDPH, or what the folks are doing at IDPH, if somebody does run into a PPE issue with regard to this, they do have, I think, a 60-day supply now. So some of those, maybe you have some high needed assets to help you or in your county administer the vaccines, and you need something, please just be a squeaky wheel and use the resource request process as we've had it outlined. There have been a few small changes to the resource request process, but nonetheless, elevate that so they can help you out. They were really quick with this, with getting us once they had the directions on where to drop it off at for this freezer, the guys were really Johnny on the spot on this one. So they've worked out a lot of kinks in equipment, supplies, and getting stuff. They've got a lot of logistics folks, a lot of loggies that are helping out this time to make sure this goes as smooth as possible. You know, it won't be perfect, but it's going to be the best way that they can do it. You know, in it, and with those notes there on the side, and their goal is to basically reduce complexity and whatever logistical needs that are out there, reduce risk, and as time goes by and shipping dimensions and requirements start to get smaller, it'll just be easier on the back end. So once we get to the point where, you know, we've made it through the first push of these vaccines, you know, and the 21 or 28 days afterwards, things should begin to be a little better, and Pfizer and Moderna will be able to ship out more on-demand amounts for locations as time moves forward. The talk is basically we will be in, if you guys, you know, all the phases, phase 1A, where we're at, where healthcare workers are at. That's going to probably last, you know, 30, 40 days, to be quite honest, you know, to make it through all of that. You know, and that's really not including the second dose. So when if I say 30 days, you probably should be thinking more like closer to 60 days because of the time for the second dose. But to really push forward to get that initial distribution out, they're looking at around 30 days. So, any other questions with regard to this basic process? Any needs to support this process?
Phil, this is Tina.
Yes, ma'am.
Question. So is Fayette County Health Department, will we be getting our supply from you?
Okay, so great question. As you guys may or may not know, if I ever say we're in specific region, you know, you have one of maybe 5 to choose from when we're doing that. So I'm going to pull up this list here. As you can see, these are the lists of the counties that I've highlighted. These are the top 50 counties and that will be receiving vaccine. And in those, you know, when I went through this list, I was like, okay, let me make sure I highlight all of our counties. So on this, I have all of our counties. And when I say our, I'm talking about the Hope Coalition or our public health and medical services response regions. Okay, that's why you see Fayette County on here. Now, some regions, some RHCCs, their response region and their EMS regions all magically align. We're not one of those folks. We have a very mixed bag when it comes to like the EMS regions. So Fayette's not in our EMS region, but you're in our medical response region. Jersey's not in our EMS region, but you're in our medical response region. So there is a bit of, and I don't see Beth on yet, but we were just talking about this with Greg a little bit ago. They're trying to make sure that we can nail this part down very soon if you haven't already been told already, because I do not have the final list. Because we may have some instances where, let's say, Greene County would be going up to Springfield. I know Greene County, Greene County is number 1. So Greene County will be going up to Springfield. But we believe that you guys may be coming down to us. So I really have to wait until we have that fully nailed down. But that is the kind of the conundrum that we're in at this time. But hopefully we'll have that answer before the end of the week. So that way we can tell you if you're going to be coming here or if you'll be going up to Region 6 or what have you. So I'm sorry I can't give you that direct answer today.
And because it's going to the health department, and Beth has reported that she's talked to the health departments, and the health departments have all said they want to stick with their public health and medical services response region, meaning Phil. Mm-hmm. Then that is the way it should be coming. So Fayette County Health Department should be coming to Belleville and not going to Champaign, because they have reported that to Beth, who will report that to the RSS, who will package it that way.
Yep. And I will have that list once it's finalized. That is the way we're leaning. You're absolutely right. That is the way we're leaning. But as I started this meeting off, if something changes tomorrow, don't be upset. It's just it's just the nature of we can be as deliberate as we want, but it's crisis planning at this point to try to make sure that we get there. So questions, other questions?
Hey, Phil, this is Chuck. I've got a couple questions. So one, I have employees that live outside of those highlighted areas.
Mm-hmm.
And I have employees that live in Roundoff that work in St. Clair. I have employees that work in St. Clair or Macoupin.
Yep.
Where are they to get their vaccination from? Their home county or locally? Since we can't get past this EMS doing their own.
I'm tracking. The primary, the number one answer is the goal is where you work at. Okay, so I guess that would say locally. Like for us, we've got lots of folks that work in or that live in St. Louis, but they work here. Same. They're expected to get it where they work. I do know that again we are in a pinch, if you will. We are in one of those, we have a time constraint associated with this specific distribution model today. In the future, we may not be time restricted because we can ship ultra cold and maintain it a little longer, and we can do it a little slower. But today, we are in a position where I do believe that you may have someone on day 4 or 5 that may not fit any one specific category, if that makes sense, or live in any one specific area in which they would say, oh, I would normally get my vaccine where I work at in St. Charles County or North County on the Missouri side, and probably receive it somewhere here in the Metro East. That's a potential. The plan is, again, for where you work, to work that way first. And so being within your local jurisdiction of where you work and operate.
So let me just speak up here, because remember, all of this has been planned out for years by the health department. So the health department should be able to speak to their employers that are in their jurisdictional county as to how they have that set up. So is there a health department on that would like to speak to how they have it set up in their county where it comes to employers?
Yeah, so this is Madison County. So if like what Phil said, it is usually towards the employer where they work. So when we discuss with employers what their population numbers look like, that includes everybody that is employed by that employer. I don't look for individual people in different counties and go from there. It's all that one employer.
Okay, I just need to know which way to guide my people. That's where I was going with that, because I do have several that live outside of this response region that work in different counties. So I have to figure out how and where to tell them to go.
Right. So as an employer, Chuck, you have Randolph County. So you should speak with Randolph County about those. There are exceptions to that rule. So we have EMS systems who are intending to acquire vaccine for their EMS providers, not through their employer, but through the resource hospital, who live in multiple counties. That has been brought up, and we have heard at least one from St. Clair County that they will need to work with the multiple counties in which those employers are all in for that EMS resource hospital to get theirs. But you as an employer, you should be dealing with the one where your a base of operations are. And I believe you have Sparta and Randolph, and don't you also have a base in St. Clair County?
I have 13 bases in Randolph, St. Clair, and Clinton counties.
Okay, then those are the people that you'll need to work with for those. If those are your employee bases, you'll need to work with those counties as the employer to get your folks at those bases done.
Okay.
And Chuck, this is Sam from St. Clair. We can talk offline after this if you want, but our EMS, we are counting the number of EMS paramedics, medics going through the hospital systems.
Yeah, yours is going to be one of my biggest conundrums. I've got at least several employees that live in Randolph that work in St. Clair. I have at least one that lives in Macoupin that works in St. Clair. That's why I was trying to get it clarified where I need to be sending them, because when you look at our distribution, we have a wide breadth of where our employees live and commute to work. So I was trying to get clarification, but yeah, I'll talk to you offline.
Sounds good.
Hey, this is Angie from Randolph County Health Department, Chuck, and I think that I'd already planned on helping the Randolph County locations here. I already factored you into my planning. It's just a matter of when we can get vaccine and get you guys rotated in to get it done.
Yeah, I knew you and I were good. Stephanie's the only new one that I have to deal with out at Clinton County, because I haven't talked to her much.
I'm willing to help out in whatever ways you need. Just let me know. And I've been working very closely with Louise McMinn. She's helping out also. So if you have her contact and you're more comfortable contacting her, that's perfectly fine as well.
That works great. I can do that through her husband.
Great. Okay. All right. Great conversation there. Let's move off just to the next portion of the distribution model. Some of this I know you can't really read, but basically as far as the chain of custody goes, as it comes from the RSS site, they will be driving it down. An ISP will take, I'm going to say, possession of it, and they will be the ones that will sign it over to me. Once I receive it, and that's the form on the left. Once I receive it, do a quick inspection, etc. Mark date and time that it was arrived. I will in turn have a secondary piece of paper that will be for the local health departments. And then those will have on there the description, quantity, etc. And those numbers, the goal is for all those numbers to jive with what you've been provided. So again, Beth is working with each one of the counties knows what their number is. So the hope is that those numbers will all match. So Sam, I'm just going to use a number. If Sam's supposed to get 2,000 doses and that quantity says 2,000 of COVID vaccine, blah, blah, blah. Hopefully those things align. We do have some fallback if we need to contact and say, hey, we didn't get what we were supposed to get. We do have some of that. We need to make copies, and all of that needs to be, and as you can see on here, all of that needs to be faxed back up to the RSS, back to the federal warehouse. So it has a spot on there for everyone for you guys to send it back to. I would like to keep copies of all of it. So before you leave, before any health department leaves our property, we want to make sure that we have copies of everything. Okay, we'd like to make sure that we're a fallback for you guys if and when maybe something gets lost, flies out the window, somebody spills coffee on it. So that once we've done that portion there and it's signed over to the local health departments, then they can start divvying it out and sending it to wherever it needs to go. Okay, but we have to make sure we do that step before you either leave and go back, or we go to our auditorium and begin to break down what we do have. Okay, any questions with regard to the documentation? Okay. Just a few notes from the tabletop that they ran yesterday, that the state ran yesterday. So we had health departments, had a bunch of folks from a bunch of all the RHCCs across the state and several IDPH, IEMA folks on here. In their tests, basically, the shipments arrived around 10 a.m. from Pfizer. And basically, they went down and the RSS would contact that RHCC the day prior to shipment. So on day one, and give them that departure date. Departure date, again, as we kind of talked earlier, should leave on or about 6 a.m. The next day. Chain of custody, like we said, was maintained by ISP. After we complete the transfer, we got to scan all that back. And if there are any media queries, okay, there is a spot that they're asking everyone to forward those queries to, and that's covid.media@illinois.gov. Now, Greg, I don't know if you were on that call. I don't know if those were for all state-related media queries. And when I say that, I'm talking about from local health departments up, not at the organizational level. Do you know if there's another spot for any organizational media requests outside of them dealing with it with their own community relations or media teams?
That was specifically for questions about the distribution, the setup of sending it to the REC, to the local health department. All of those are to be referred to that email that you just said. Now, there might be something specific to a local health department that doesn't have to do with the actual state plan of allocating, and that would be up to the local person as to whether their PIO would deal with something like that. And I can't think of an example in my head, but if it's totally at the local level of the health department and it's something they're comfortable dealing with their PIO, they're fine going that. But any inquiries as to the distribution, the allocation, the process of sending it from down to the RHC to the LHD should go to that state media site.
Thank you for clarifying that. So if you're not able to see what I do have up there, again, it's covid.media@illinois.gov. Okay. Last part I want to quickly or discuss before we kind of open it up a little bit is the actual administration of the vaccine, and from an organizational level. I put together just a small tool up late last night, just like thinking about this. I was like, we need to make sure that we're able to meet the throughput. And the reason why I say that is because, again, we're going to be limited to, at the maximum, probably 4.5 days to get this done. So if Memorial Hospital, I'll use St. E's. If St. E's gets 1,000 doses and since let's say St. E's gets 1,000 doses, they got to do 1,000 doses in a finite amount of time, and try to put together just a tool that anyone could use to help them determine whether it's manpower requirements, how much you want to get through in a specific day. So that's what this tool is. I'm going to just do a quick, 2-minute, 5-minute demo of it at the most. And this is available in D4H. I did upload it in D4H in the regional instance of D4H. So you guys can download a copy of it if you choose to use it. You're probably already doing something that you're comfortable with. But I felt like we were struggling with trying to do this because of several issues, but hopefully this will help put us in the right direction once we start our vaccination clinic. So basically how it works, you have an option 1 and an option 2 here, which basically gives you an opportunity to look between 2 different models. But let's say, again, I'm going to use St. E's. Brad, you're on. I'm going to ask you a question or two, but let's say they have 1,000 doses and they want to say, I want to get this done in 4 days. So I just put the number 4 in there, and I want to operate 24 hours a day, or I want to operate 8 to 5 daily. And we believe we can administer vaccines at 10 minutes per person to do vaccines or registration, all of that, whatever number you believe that you have there. What this basically tells you, and I use this because it's a pretty straightforward model, is it basically says you need to do 250 doses a day, which is roughly 31 doses per hour. And then it kind of gives you a little manpower breakdown here for vaccine administrators with and without breaks. So I'm going to use the with breaks. That means that they have an opportunity over a 12-hour shift. So we kind of have built with the 12-hour shift built in there. But you need about 5.8 folks to make that happen. It's straight vaccinating, and then support staff with breaks with around 3.5. So it gives you a total of about 9 people that you would need to run for 8 hours a day to meet that 1,000 dose mark that you have up there. If your staff is able to keep a throughput of 10 minutes per person, then it just shows you one without breaks, like, you know, they're just kind of working straight through, pumping through, but those numbers are very similar, so they're off by about 1. And let's say you want to do a slightly different model. You may say we can do it, or we have, what happens if we get 1,500 doses? We want to get it done in 4 days, and we do it at 24 hours a day, and let's say we'll have them a little more trained and they can get it done at 7 minutes per person. And then it gives you some more information here. So in this model, you don't need as many folks. You need around 3 folks to do administrations across that. And I got to double off. I'm going to fix that little thing because it's showing the, what do you call it, twice. But the blue number is correct, showing you need about 3 folks to get that done. And it should give you something to help you work through your vaccine planning model. So any questions on this?
Hey, sorry, Phil, I don't know if I missed it. Is this going to be available for all the hospitals to use?
Yeah, it's right now, it's in D4H. So if you go, I'll show you exactly where it is just right quick. If you're on it, you can see it. So if you go into the regional pandemic instance of D4H, just jump down here in the library. In vaccine guidance documents, you will see something that says vaccine personnel model. I'm going to make a quick adjustment to it and re-upload it, but this is where it'll be. If you're in there now, you want to download it, this will work. But I want to make sure that that option 2 version, the breaks are accounted for correctly, because it looks like they were duplicated. But I'll fix that. It takes me 2 seconds to fix. But yes, it's there, and I ran the numbers like at least 20 times in my head last night, and then on paper another 50 times afterward, just to make sure that the math was pretty much right there. So something that'll help you if you are struggling trying to identify some staffing needs. Sometimes we may overstaff, which is fine, but you want to make sure you can maintain that throughput because we have a finite amount of time and resources to do this. So any other questions, concerns, thoughts? I mean, I'm going to open it. Go ahead.
Sam, thanks for making that available to our hospitals.
Oh, no problem. I didn't have anything to do at midnight last night, so I just was figuring I'd do this. All right, so anybody, I'd like to open it up now just to kind of discuss things. What are some of your guys' plans? I know there's a lot of trepidation, going on. Still a lot of angst, a lot of nervous energy about making this happen. Some of you guys may be cool as a cucumber, but I do feel some of the stress some of the folks are going through. So I see. Talk to my folks up at Alton. Ashley, what are your guys' thoughts? And I know that there's been some, being a part of BJC, that we have kind of 2 models working concurrently. We have what's going on in Illinois and we have what's going on in the St. Louis area. How are you guys doing?
I don't know if Ashley's microphone is working. This is Amy from Alton.
Hey,
hey Phil. I would say that I agree with what you said. We're trying to kind of balance information that we're getting from a lot of different resources at this point, but this is very helpful. And Michelle and I have been chatting too. We're going to connect with Madison County Health to further coordinate. But I think we're doing the best we can. We were delayed getting into iCares, but we're in now, so everything's okay.
Great, awesome.
Can I also, this is Michelle again, for those that may not have been receiving any type of siren messages, I can recommend maybe starting to try to enroll in Illinois siren electronic notification. I feel like that's going to be a main communication mode per IDPH. So I just want to make sure we get all enrolled as well.
Gotcha, Michelle. And thanks for that feedback, Amy. It's kind of weird, both being BJC, but you guys in Madison County. So there's always going to be something that's going to be slightly different between facilities. Brad, are you still on? I'm trying to see if I see Brad Perry still on. Brad, how's the good folks at St. E's doing?
We're doing good. We actually went ahead and did a survey, which we got awesome response on, surveying our staff on whether they're going to accept or not, but yet not committing to it. And that's really helped us in our preparation. Until you have an amount that we know we're going to receive, it's a lot of kind of planning the what ifs. So we're kind of planning if we get only 400 versus if we get 900, and what if we're going to do if we get 900? What if we're going to do if we're going to get 400? So I think we're set. I think we're just kind of in limbo until we get some kind of numbers on what it is that we want to do.
Would you mind sharing just kind of generally, when you said you had received good feedback, what type of, I'm going to say percentage, did you guys have like a percentage of folks that basically saying, yeah, I'm definitely going to get it?
Well, and that's what's really surprising us. And we think a lot of the press that has come out lately is probably a part for that, in addition to our medical directors doing videos and putting them on our intranet on their opinions about it. But within 24 hours of us releasing it, and this is system-wide, this isn't just SAO. So we sent it to 8,500 paid employees through HSHS, but we did, break it down by hospital. Within 24 hours, we had about 36% respond already. And we're pushing almost 60% of those who have responded that are in favor of getting it. So in all honesty, our numbers are a little bit higher than what we originally started planning weeks ago. But we're making adjustments for that.
Hey, Phil.
Yes.
Can I just say a couple things and then ask a question?
Sure.
So the first thing that I wanted to say, and I know all of you are aware of this with these tight vaccine amounts, we don't want any of the vaccine wasted. So please be taking that into your plans that we don't want any vaccine wasted, especially in these early few weeks. Also know that what's happening this first week, maybe the second week, going into the third week may not be what's happening in the fourth and fifth week, meaning we may be getting stuff where we can store it and have longer than this 5-day window. That is the absolute goal in your planning where you won't be under such a burden to get this into arms in that short time period. And the reason that I bring that part up is anyone at the hospitals or the large providers looking at how are you going to prioritize and how are you going to decide, knowing that there are some side effects with this one. It appears more side effects with the second dose, but side effects with the first dose. In making sure, as an example, say, vaccinating your entire ICU staff on day one and having half of them call in sick the next day. Are any of you guys planning anything like that? And how are you handling it? Just for maybe some help with the other hospitals.
Greg, we are. We asked them to give their employee ID number, and we're able to, on the back end through pivot tables and so forth, to match them up of which department. And then our coordinator our lead for administration, is then meeting with the managers. And if they have a high response number, then we're going to schedule it based upon their last day of work before time off, depending on which department it is. But there is strategic plan to break it up. For instance, the ICU being one of the most critical. It's the lowest amount of nurses that we have, but yet it's probably the most critical. They can sign up for the last day they work before certain days off, and that kind of helps scatter and helps schedule. But they're doing different departments different ways in doing that.
That sounds great.
That's a great conversation there. So, and Brad, thanks for sharing both of those tidbits that you provided. Anyone else? Tina, how are you guys doing out there? In Fayette, did she have to walk away? I don't know if she's there. She's got her camera on. Okay. Well, your feedback initially was very good, Brad. You know, I know a friend of mine who works with OSF. I think their initial feedback that they got was lower than that. I think it was slightly lower than 40% initially, but I'm not sure how long ago that was. So Gary, if you're still on, how's your staff looking at the perception of the vaccine and potentially using it? I don't know if Gary's still on. Let me see. Nope, I don't see Gary. I do see Eric over at Touche. What are your thoughts and how are things going with you guys?
Hey, Phil. So far, there's a lot of confusion, or I guess there was. We're actually having a meeting this afternoon at 4 to discuss our committee and the planning of the vaccine, since we do have different people that have gotten different information. So we're pretty much going to clear that up today. I'm going to present some of this to them, and I appreciate you for the graph that you sent out. I'm definitely going to present that in that meeting as well. So right now we're just gonna wing it until this afternoon, and hopefully we can have that figured out. The problem was initially that we were going to get cold storage. So we actually ordered a cold storage freezer, which I'm sure some other hospitals and departments have done as well. But now we're just gonna change that tactic up a little bit. And that's something else that we're gonna be talking about today. So a lot of planning going on today. We will definitely, hopefully, know a lot more next week by the time next week rolls around with this.
Indeed. Well, thank you for sharing that. And
Bill,
I know we are here right around the hour, so I do understand if some folks have had to drop off, but I do want to, again, continue to keep the line open just for a little while longer for additional questions, concerns, issues that folks may have. Someone was about to provide some feedback.
Bill, this is Tina. Sorry, I couldn't get my mute and unmute to figure out what I needed to do. But I'm just going to echo what Brad said, how we're looking at it internally, looking at days off when they work and trying to coordinate it that way too.
Indeed. Are you guys, and I'll put this for everybody, are you guys doing like a call center for folks to call in? Sounds like that's what we'll be doing basically across BJC, and, you know, to be reevaluated with the understanding that, yep, you just got the vaccine. You've been educated to mRNA vaccine. Are you experiencing these signs and symptoms, blah, 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 and then making a judgment call on whether they're to return to work or not, or in restricted capacity or whatnot, or are you guys just doing that at the department level? Maybe more of a question for Brad. I don't know.
Yes, and I don't know if exactly it's a call center, but we do have a follow-up process that we're dealing with. And then I like that call center idea. I'm actually typing it right now. Didn't kind of think about if your staff member just wants some advice before turning around and coming back to work. That I didn't think of, so I will be bringing that up. Thank you for that.
No problem, Brad. And if there's one thing I did want to talk to with regard to waste and what Greg was talking about earlier, is that there is some language within the plan that basically says, and I will see if I can pull that up. Give me one quick second. But there is some language within the state's plan that basically says, if you find yourself, let's say it's day 3 and you've gone through, you don't have any more employees or staff that, you have more staff that want to get the vaccine, but you've got 200 doses remaining. We may find ourselves in that predicament. The goal should be to use as much as you can for those who are in that 1A category, but you can kind of go down through, and I'm going to find the excerpt. You can start to go down through 1A, now down to 1B, to make sure that you're using all of that vaccine. Okay, so there's no return policy here. You can't send it back. And I'm not sure, and I don't know if anyone from the health department would like to talk about it, if you have any contingencies for that. But in the model that I'm just discussing, Brad says I have 200 doses left, and we got the next 48 hours to get it done, but we don't have any more folks. They're trickling in. Maybe we can get another 50 out of it, but we may waste up to 150 doses. And maybe over at Memorial Hospital Belleville or Touche or Gateway or some other organization, maybe like I still got folks, I used all of mine on day 3 and I still got folks that want to get it. Have we talked about any of the potential redistribution or providing, a shot clinic for the outside staff? Has folks start to look at things like that? Sam or any of the other health departments, has that been a part of any of your conversations?
Yeah, this is Michelle. Yeah, it has. And like you said, we just definitely don't want to waste anything. So we did hear the same thing about going through the phases. But if we need to, especially in Madison County with the 5 hospitals that we have, this is going to probably be something that we may discuss in a future meeting here whenever I get that scheduled, to just determine if we want to do the redistribution, if time allows. I know with us here at the health department, we're going to be trying to monitor that inventory just to make sure that we don't hit a deadline on the day 5 that we kind of outlined.
Phil, this is Sam. We are in the same boat as Michelle. I wasn't too concerned with it for this first shipment simply because I knew with the first shipment we weren't going to get the larger numbers that I think we would run into that problem if we had larger numbers for the number of doses we were receiving. But it's certainly something we've thought about and, have in the back of our mind if that does become an issue where we're contacted with someone who has vaccine that, is in jeopardy of not being given.
Understood. And here's the language out of the plan, the state's plan 3.0. It's on page 10. It says, in each phase, once the priority groups have been satisfactorily reached, vaccine administration planning can then focus on reaching the next population of focus or the general population where the overarching goal is to elicit herd immunity. So you can continue to go down that list of folks. I would just ask that, or I would think that you just want to make sure that you're prioritizing it correctly. But I mean, you could be providing vaccine to potentially, I don't want to say someone who's not your staff, but, I don't know if that maybe even go all the way down to patients. I have to go back and look at all the priority lists or each one of the phases, but go ahead, Michelle. I think you're unmuted. Go ahead.
Yeah, I just would say to just document and give reasoning why. But yeah, we definitely don't want to waste. So if that's the option, then we'll do what we can do.
Indeed. Yeah. And I asked our folks here that we could open it up as far as we could. We're looking at our, private practice folks, or, those folks that are associated with Memorial, physicians outside of Memorial, proper, not hospitalists or surgeons and stuff like that. We're trying to look at every option that we can use any of that extra. So, all right, guys. All right, again, last chance. Anyone with anything additional to share and or discuss? Questions, concerns? I mean, you still got some of your experts here, your health departments. You got Greg online. No? Okay.
And for the Madison County hospitals, I'm going to try to make my rounds again to contact you one-on-one and go a little bit more and then get a meeting scheduled. So I just want to throw that out there if there's any Madison County left.
Awesome. Thanks, Michelle. There was someone behind Michelle I thought was about to talk. Lee, am I forgetting anything?
Oh, sorry, I had to unmute. If your entity does need support in the form of like gloves, we do have the vinyl gloves still here. We have several cases of those remaining. Same thing with the isolation masks. We do have some gowns that are available for patient care environments, as well as face shields. So if you need them, please do let us know. For the vaccination side of things, those vinyl gloves are ideal. You don't have to waste your nitriles on a single type of patient, I guess you could say, a single touch that doesn't need it. Just let us know. You can submit the request through D4H.
Awesome.
And Phil, did you touch on ILEAS?
Well, I did a little bit earlier. I did talk about the as far as them escorting, et cetera. Go ahead. If you want to say something, I can just follow up.
No, I just wanted to make sure you did. I had a phone call come in while you were dealing with it. So.
Okay. Yep. Greg, am I missing anything? You got any last parting words? Anything?
No, I think you did a great job in explaining it. Just knowing that this is going to evolve over the next few weeks, and what's happening today is probably not what's going to be happening a month from now. So just be ready to pivot.
Indeed. If you've never heard Semper Gumby, always flexible, be that way. Let me talk to my conscience for 1 second. John Nowak, this nice little green button on yours says that you're free to talk right now. Am I missing anything, or is there anything that you need? I know you and Chuck are probably working in the lab, and definitely will be following up with Sam and teams. Anything I'm missing? Oh, you just got... I'm sorry, you came in broken, John.
Here we go. Now I'm trying to I couldn't get unmuted.
No problem.
Well, I have thousands of questions running through my head, but I'll let them go and maybe touch base with you on the side, or maybe Samantha.
No problem.
John, 1,000 questions is a lot.
Honey, well, unfortunately, it might not be 1,000, but I'm sure I got quite a few. My big concern is the side effect. Me taking 60% of my employees and 30% of them have an issue with some type of side effect. That's one of my big worries. I do know that we have had a lot of people that have said that, yes, they are willing to take it. So, but truly, yeah, like I said, I've got a lot of questions. I think you've answered quite a few of them. MedStar is going to be confusing because we are in 3 different counties and we've got employees from all over the place, but I think we kind of got that mapped down. It's going to be by where they work at which county. So, yeah, no, I think I'm good, sir, for once.
No problem, John. No, just had to touch base with the conscience. So, all right. Well, team, thank you. I would not be surprised if things change slightly from what we've discussed today. But again, please be patient and flexible with that. We're all working together to make sure that we can do the best for the community and for your staffs around here in the region. I probably will, depending on how the week ends, we may set up another call prior to whatever the real estimated shipping date. I'm sure because tomorrow is when I believe they're going to potentially approve the EUA, which means that we'll probably have another update, which will say that these are more defined timelines, and then we can go forward with better assumptions in those timelines and flush out any additional things that we've discussed, like today, with regard to EMS or any other things specific to that before next week. So if you don't hear back from me by the end of the week, you may hear back from me first part of the week. So hopefully we'll get some more updates on tomorrow's call, and maybe we'll have a Monday or Tuesday follow-up meeting. So please be on the lookout for that. So, all right. Thanks, everyone. We're going to end it here. Please stay safe. And again, I appreciate everything that you guys are doing out there in the community. We're not through it yet, but we're going to keep going. So we'll get there. You guys take care, and I will see you soon.
Thanks, Phil. This was helpful.